Assalamu alaikum. Here are some tips for the beginners who want to start with laparoscopy. The word of encouragement is that any case which is operated in an open approach can be performed laparoscopically, and for that you have to develop your own skills in such a way, in a structured way, that it is an exercise of the skills, but as well as it is more of a mental exercise that you have to go through. And for that, you have to start with the certain type of cases and certain type of procedures. So first of all, case selection is really important. There should be no history of previous abdominal surgeries if you want to perform a transperitoneal laparoscopic surgery. You must select a case which is very easy to perform. In urology, all of them are, they start from level 3 surgeries, level 3 and level 4. So the easiest of the cases and the shortest of the cases in urology is the deroofing of the renal cyst. But you have to keep in mind that there must be indication for it. Doing small cysts like 2 to 3 centimeter, which are asymptomatic, they are not really justified. So the essence of this is that you start the case, you create, and you position the patient, you create the pneumoperitoneum, and then you place the ports, and then you go in, and within 10 to 15 minutes, you deroof and come out. So this will give you a sense of achievement and a sense of success, and also give you encouragement for your next cases. And the ideal cases, or the ideal patients to be operated by a beginner, it has to be the age has to be 30 to 50 years of age, and it's better that it's a female who is multiparous and is of a normal stature. It shouldn't be too short, it shouldn't be too huge. So BMI which is less than 28 is the ideal, and a height which is around 5 feet is an ideal patient, with no previous abdominal surgeries and 1 or 2 pregnancies. Then in order to have good laparoscopy and do it with the sound mind and confidence, you need to counsel the patient regarding the conversion. If you don't counsel the patient for the possibility of conversion before the surgery, and then during the surgery, if you have to convert the case, you will be going through an unusual stress and an undue stress. So it's better to counsel the patient before conversion. This will give you a lot of confidence. So you will be able to complete the procedure. And if you require any conversion, you won't be going through the undue stress. Then a good and a sound sleep with at night before the surgery is really very important. Try to sleep early, try to wake up early, and do a breakfast regularly while performing before the laparoscopy. And you should be in a good mood while going to the hospital for performing a laparoscopy. It must always be the first case in your initial phases of laparoscopy while you are performing it. So because if it's the second case or the third case, so it will you usually get drained as the operation theater it progresses during the day. So it should be the first case. The anesthetist should be fresh. You are fresh, and your assistants and your team is really fresh and is willing to perform any kind of such procedures. So this will give you confidence. Once you are through the initial learning phase or the learning curve, then of course you can perform 2 or 3 laparoscopies in the same day. But initially, you need to have only 1 case of laparoscopy, and it should be the first case. on the list. And on that particular day, you must not have any other engagements. Like, for example, if you are a teacher, you have to deliver a lecture in the medical college or in the postgraduate institute, or deliver a lecture to your students during that day, or you have some other administrative or academic meetings, then you should not start that case, because the case can take more time as opposed to the expected time. So if you are looking at the clock and your meeting is coming near, then of course you will be in a haste, and that can lead to shattering of your confidence. So on that day, or at least in that case, the only thing on your mind should be that case. So in this way, you will be in a better position to successfully complete and perform that case. And always remember, never try to be fast in any surgery, but especially in laparoscopy. They say that there is a famous quote that slow is smooth and smooth is always fast. So the slower you are, actually the faster you are, because if you are in a hurry and you try to be fast and you make a mess, and then you take the double time as compared to in a case where you will not be in a hurry and you have not made a mess. So slow is smooth and smooth is fast. And check before starting the case, check all the required gadgets before starting it. Always check the camera, the tower, the insufflator, the gas cylinder, the ports, and the hand instruments, the energy sources, the clip applicators, and the open trolley, always before that. And once you have performed the procedure successfully, always praise and thank Allah for the successful operation. Thank you very much.